Treasures. Here we bring to you African arts, culture, and music. We also discuss issues of concern to people of the African descent in America, the Caribbean, South America, Africa, and all over the world. We invite you to come and see Africa in a positive light. So stay tuned and tell your friends to do the same.
Welcome to another exciting episode of African Treasures. I'm Dr. Michael Okeke, your host. Today's topic is vision health, and we're going to see how it relates to people of African descent. And I can't talk about this medical topic without having a specialist by my side to help us explore the issue. And I have a physician, board-certified physician, who specializes in the area of ophthalmology, in the person of Dr. Richard Lawrence, to help us, to help educate us on this topic. Welcome to African Treasures, Dr. Lawrence.
Thank you. I'm happy to be here.
For the benefit of our viewers, can you briefly introduce yourself?
Sure. I'm originally from Philadelphia, Pennsylvania. I've been practicing ophthalmology here in Atlanta for 2 years. I did my medical school training at Morehouse School of Medicine, where I am currently on the clinical faculty. I just recently opened up a practice on the west side of Atlanta, and I'm excited to be pursuing that endeavor.
Yeah, thank you. The field of medicine is very broad. And why did you choose ophthalmology?
Fortunately, my father has diabetes, and diabetes caused changes in his eyes that resulted in what's called diabetic retinopathy. And diabetic retinopathy affects the blood vessels in the back of the eye of many diabetics. And in his case, it led to retinal detachments. He had to undergo many laser treatments, many surgeries, which then led on to further complications of cataracts and glaucomas in his eyes. All of the treatments that he had to undergo led to my interest in ophthalmology.
Okay.
Unfortunately, he eventually lost all of his sight, and it became a mission for me to prevent blindness in others.
So you're actually driven from within, from what you saw. A lot of people get into some profession because of the prestige. Others get into it because of maybe they think they're going to make a lot of money and be able to support their family. And you went in because you want to help people.
I want to help people. It became a mission for me to prevent blindness in others.
Okay, that's wonderful. When people have eye problems, some people may say, well, I have a cousin who fits glasses. He's an optician. I go there and have him check my eyes. Some of them might say, well, I have a friend who's an optometrist. I'll go and let him see about this cataract I have. Somebody might say, well, I don't know about ophthalmology. I never heard of that before. So please help educate us here. What's the difference between optician, optometrist, and ophthalmologist?
Okay. The optician really is there just to fit a patient in the glasses. Mm-hmm. I'm going to use the analogy of a pharmacist.
Okay.
The pharmacist receives the prescription from your physician and then dispenses your medicine, whereas the optician receives the prescription from your optometrist or ophthalmologist and dispenses your glasses.
Yeah. So then the optician does not prescribe medication?
No, it does not.
Or tell you what type of eyeglasses you can use. Now, but optometrists can, and ophthalmologists can.
Yes.
Then what's the difference between ophthalmologists and optometrists?
The ophthalmologist, just like your primary care doctor, just like your surgeon, has had to go to medical school for training. After medical school, they had to do their internship, and then went on to do their specialty training as a residency.
Yeah.
The optometrist has only had to have training for just fitting people in glasses and contact lenses.
So they do with glasses, contact lenses, the optometrists. Now, they don't do surgery. So, for instance, if you have to go under knife, they can't do that.
No,
only the ophthalmologist can do that.
The ophthalmologist can do surgery on the eyes. The optometrist is not trained to do surgery on the eyes. The ophthalmologist has had training on the entire body and understands how the different systems work with the eye as well. The optometrist has only had training in just the eye itself.
Limited.
Yes.
So in other words, an ophthalmologist can do just about what can take it from optician, optometrist to another level. I mean, in summary.
An ophthalmologist can do all three of those things.
Why the optometrist is limited and the optician is highly limited.
Yes.
Okay. Well, thank you for clearing this up. The reason we're looking at this is to see how it relates to people of the African descent, because some of these health problems vary from one race to the other. There are some people of the African descent may be responding to a particular illness, or may have a particular illness in a higher degree than people from other races. So we're going to take a little station break because it comes very fast. And when we come back, we'd like to see how this eye care problem affects the people of in African descent, which is what African Treasures is more concerned about. Okay? So please don't go away. We will be right back with Dr. Richard Lawrence.
The Law Office of Donald P. Edwards is proud to sponsor African Treasures, a program that celebrates the African continent, its people, its music, its past and its future. Wherever we are on the face of the earth, we are an African people.
We are bringing the treasures of Africa from all parts of the world straight to you.
We're back with Dr. Richard Lawrence, an ophthalmologist, talking about vision health. And in our previous segment, we looked at clarifications of different doctors or specialists in eye care. And right now, we're going to get into seeing how they affect people of African descent. So welcome again.
Thank you.
Now, your father had this diabetic problem.
Yes.
That affected the eye.
Yes.
How does eye problem, how prevalent is it with people of African descent as compared with other races?
Unfortunately for people of African descent, especially African Americans, due to our diet, our higher prevalence rates of diabetes. Unfortunately, they wait until they start to have vision problems before they come to see a doctor. In reality, they should be going to see their physician if they have diabetes on a yearly basis.
I'm going to try to pronounce this word, but don't. Retinopathy. Did I get it right?
I'm sorry?
Retinopathy.
Yes.
Okay. Diabetic retinopathy. That was what your father had, right?
He had diabetic retinopathy.
Okay. That's what I was.
And that had to do with the back of the eye is called the retina, and there are a series of blood vessels that traverse that retina.
You think it was because he didn't seek medical attention early enough that he graduated into that? What do you think contributed to that?
I think what contributed to that in him was that he had a type of diabetes that was called juvenile diabetes. So he had diabetes all his life, since he was a teenager. Unfortunately, over that time period, it was probably too late in his life before he first began getting his eye exams and first began getting treatment. If he had had treatment sooner, some of the complications he experienced may not have happened.
How often do you encourage people to seek eye care?
It depends on the individual themselves and between them and their doctor. There are risk factors that have to be considered when telling someone how often they should seek eye care. If they have a history of any eye injuries, if they have diabetes, if they have a family history of any eye problems, and if they're African descent or age 40 and above, they need to see eye care.
More often?
More often.
Like once a year or twice a year or what?
Once a year at the very least.
That's interesting. When we seek, when somebody tries to seek eye care, does he go to? Do you recommend they go to optometrist since it's limited, or does he go straight to ophthalmologist?
It's in your best interest to go to an ophthalmologist because an ophthalmologist can look at your eyes and see how it relates to the rest of your body.
And
they can do total eye care. They can evaluate your entire eye health.
Right, right.
They can treat any problems you have.
Right.
They can take you to surgery if you need to go to surgery.
A lot of us go to optometrists, and of course, optometrists are good. I'm not here to knock their qualification or their skills, but are they equipped to detect the presence of diabetes or an eye problem that's caused by diabetes? Are they equipped to do that?
They certainly are equipped to identify those eye problems, but unfortunately, they aren't equipped to treat those eye problems once they occur.
Okay.
Many times, there are many places you may go for an eye exam. And you're only getting an eye screening. You're not getting a complete eye exam to assess what your eye health is.
I know we have a hypertensive retinopathy, and we have a cataract problem, we have a glaucoma, we have a diabetic, we have all this type of things. And a lot of people that go to see optometrists do not know what they have. And they may just get glasses. Oh, okay, your vision is this, we'll give you glasses. But the person may have diabetes that's gradually killing their sight, or a person may be hypertensive, and these things are not detected. Or so that's why I'm asking, is it better to go to optometrist or go straight to
it would be better. If you have any type of chronic condition like diabetes or high blood pressure, I'd recommend that you go straight to an ophthalmologist. Solely because they can treat any issues you may have. An optometrist, you will go there and they may identify it. They will then still have to forward you over to another ophthalmologist to treat you.
I wonder how often people are told that they may have some, that the cause of their eye problem may be diabetically related or hypertensively related or might be glaucoma or this or that when you go to optometrist's office. I really wonder because I've been, I don't know how many people have been, how many people have had that told to them.
I'm sure there are a great number of people.
You think there are?
I believe there are.
Okay. All right. Well, we're going to take a station break again. It comes very fast, like I told you. And when we come back, we'll dwell on this issue a little bit more. Okay. Please don't go away. And here with Dr. Lawrence, an ophthalmologist, and we'll be right back.
For over 10 years now, the Metro Ebony Pages has been the only directory that caters to the minority communities in Metro Atlanta. For businesses trying to reach the minority communities, the Metro Ebony Pages is your vehicle. Individuals and families looking for services within the community, look first in the Ebony Pages. You may reach us at 404-209-8654.
we are bringing the treasures of Africa from all parts of the world straight to you.
We're back again with Dr. Lawrence on this topic, health vision as it relates to people of African descent. Welcome again.
Thank you.
We just have very short time left, and I would like to. There's something very interesting about your background. Your great grandfather was Allen.
Richard Allen.
Reverend Richard Allen.
Yes.
The founder of the
AME Church.
AME Church. Please help me out. So tell us a little bit about it.
Well, it's a very interesting history. He was born into slavery. He, outside of the time, worked and paid for his own freedom. He was also a serial entrepreneur, had various business interests taking place. He went on to,
In Philadelphia.
throughout the time, when he was a preacher, when he was a slave,
Yeah.
and when he earned his freedom, he was a preacher
Okay.
in the Methodist Church.
And he founded the African.
And eventually he went on to found the AME Church and Mother Bethel Church, become the first bishop of the AME Church.
Okay. They have churches they call Allen Temple. I know that's one in Alabama, Phoenix, Alabama, called Allen Temple. And they make reference to it, but I never thought I would run into somebody who's related to the man who founded the church. And how far in generation are you from him? How do you relate?
I'm a seventh generation descendant.
From your mother's side or
It's on my mother's side.
your mother's side?
Yes.
Okay, that's interesting. And that's, if you don't, that's something and I was going to ask you if you don't mind. And that's, you have a lot of you had a lot of challenges going through medical school.
Oh, yes.
And you had some health problems that you had to overcome.
Yes.
And I don't want to say it myself, but I want you to, please, because I feel very honored to have you on my show because you overcame some obstacles that a lot of people would just give up on. So please tell us about that.
Sure. When I was a baby, I had what's called spinal meningitis. And unfortunately, it caused me to lose my hearing. So as a child and a teenager growing up, I had a hearing impairment and had to wear hearing aids. In fact, I was deaf in my right side. Within medical school, I decided to go ahead and have a cochlear implant, which is a type of hearing device which works directly on the nerves within the ear. Mm-hmm. So it's been challenging.
You had this thing before you got into medical school, and you went through medical school with all this handicap. Well, if you don't mind my using the word handicap, you had to overcome this handicap or live with this handicap and go through medical school and everything, and still came out successful.
I think a big part of it is my family background.
Your family.
As we speak, I was raised such that you never give up. You always go after your goal, and you always have a high goal to go higher. Reading about Richard Allen's life and all the things he did, all the programs he started to advance Black people in our society, made me realize that those are huge shoes to fill, and I can never fill those shoes. So, I guess everyone in my family is raised such that you be the best that you can be, and that you never give up.
That's very challenging. And so, as we speak, you had the implant with you.
Oh yes, I have it on right now.
How did it affect your? How did the students at the medical school react to you? How did the professors? How did you deal with your day-to-day challenges in medical school? Like the class work, you couldn't hear like everybody else. How did you handle that?
While I was in medical school, most of the first 2 years of medical school were in the classroom. So I was able to get a lot of notes from other people, but I had to read extensively to keep up with everything, though. So I pretty much had to read all the material that was presented to us in medical school. But what really helped me was going to Morehouse School of Medicine. It was such a small class environment where everyone knew each other and everyone helped each other.
Right.
So that made a big difference for me, whereas I think if I went to a much bigger medical school with
lost
larger classrooms, I would have been in trouble.
Well, Dr. Lawrence, you're an inspiration, I'm telling you, because and now you have an office.
Yes.
You opened up an office in Douglasville.
Yes.
Well, the address and everything, can you tell us where your office is located, the address, please?
It's located, it's at I-20 and Thornton Road. The specific address is 939 Bob Arnold Boulevard.
Yeah.
The telephone number is 678-945-3939.
Well, the telephone number will be right under your name when when people are looking at this, so they can call you and get some more information and maybe get to meet you in person, because you are an inspiration.
Thank you.
To let people know that no amount of handicap can stop you from achieving what you want to achieve. It's all about the heart. It's all about the spirit. And I'm very honored to have you on African Treasures, and I hope my viewers can be highly inspired, will be very inspired by your story. And with this, we'll bring this show to a conclusion. Our guest again is Dr. Lawrence, and I hope you've gained some information today, and thank you for allowing us to come into your homes.
Mother Africa wants you to pay her a visit.
Welcome to Atlanta, Miss Nigeria. We're so glad to have you here.
Thank you very much, Miss Nigeria Atlanta. I'm so glad to be here, and your city is so beautiful.
Yes, Atlanta is a very multicultural city with lots of African American businesses.
Well, talking about businesses, how do I get to do my nails, my hair, see a doctor or dentist or something?
Well, the Metro Ebony pages would be your answer. We have 2 editions, one that focuses on North Atlanta and one on South Atlanta, and it will tell you everything that you need to know.
Oh, really? Wow. Metro Ebony pages.
Yeah, Metro Ebony pages.
For more information on how to include your business in the Metro Ebony pages, you may call 404-209-8654.
Crack of dawn, she's roaming. City streets, she's combing. Searching high and low for a solution. But I see her, oh Lord, she's headed for corruption, yeah. So I say get it off, shake it off. I gotta get the monkey off your back. I say, oh black woman, stand and walk with pride. Get it off, shake it off. I gotta get the monkey off your back. I say, black woman, get up. Oh, it's time to stand and walk with pride, yeah. Poor black sisters been pushed and shoved. Done hit rock bottom, chasing some lost love. Looking for the answer from up above. Oh Lord, they got us sitting. Yes, our children is begging bread. And so all I've got to say is get it off, shake it off. I gotta get the monkey off your back. I say, oh black woman, stand and walk with pride. Get it off, shake it off. You gotta get the monkey off your back, no more folly around. Sell yourself short all around town, yeah. walking the streets with weeping eyes. 'Cause you done caused destruction of your family ties. Wishing, oh, you're praying, yeah, you could erase the sin. Now you're a pawn in the battle. I say you're losing the war within. So I say, get it off, shake it off. Gotta get the monkey off your back. I say, oh, black woman, stand and walk with pride.
Thank you for watching, and please join us again next week at the same time as we continue to share with you the treasures of Africa.